My name is James Messersmith. I go by Jamie, and I'm a physician assistant at North Carolina Orthopedic Clinic. I work with Dr. Scott Kelly in the total joint program here. We're team-oriented, so I specifically work with Dr. Kelly, and our care team has a couple medical assistants that work with us as well. And people are informed from day one that it is a team approach. It's not just Dr. Kelly, and it's not just me. We rely on everybody, and we're here for them to get them the best outcome possible, so that they don't have to look back. The uniqueness about one thing that we do is our style of hip replacement is an anterior-based muscle-sparing approach where we don't cut the muscle. We let them get back to a quick recovery, back to a lifestyle that is active within days to weeks after surgery, but don't lose that long-term outcome. When I was an undergrad, I kind of looked at different options along the way, and luckily a friend of mine found out that there was a physician assistant profession, which I had never heard of before. And when I heard about it, it was perfect. I get to go into medicine and do 90% of what a physician does as far as managing patient care and getting people better. And that's the reason I like orthopedics. Seeing people come in, can't walk, they're in wheelchairs or on canes and crutches because they hurt so bad, and then doing conservative things or surgical approaches to get them back to a lifestyle. It's amazing to see people come in with a smile on their face, walking like they haven't in years.